Manasri. Today's topic is predictive factors for difficult intubation. We will see definition, detection by interrogation, by clinical examination, the Makocha score in intensive care and complementary techniques. The definition is the need for 2 laryngoscopies and alternative techniques. The conditions for intubation are assessed during the pre-anesthetic visit. It should be noted that there is a difference between the operating room and the intensive care unit. Detection through patient history. It is important to note any incidents during previous intubations, especially difficult intubations, dental status, the location, and how long ago it occurred. As for pathologies, you need to look for osteoarthritis, rheumatic diseases, burns, scleroderma, ENT tumor surgery, diabetes, such as the Prayer sign, Essan's syndrome, goiter, acrometalia, and other symptoms like dysphagia, dysphonia, dyspnea, and trauma. So for the clinical examination, for example, you need to assess morphology, mobility, and the oral cavity. For morphology, look for macroglossia or a short neck, the lip test in retrognathism, which is a classification of 1, 2, or 3, biting above the vermilion, below the vermilion, or being unable to do so. So here, cervical circumference is also important, as is cervical mobility. The angle between maximum flexion and maximum extension should be 90 degrees. The distance from the lower jaw to the thyroid cartilage should be less than 6 centimeters. Limited cervical mobility, the oral cavity with mouth opening less than 30 millimeters in women or 35 in men, and the Malampati score. For class 1, the soft palate and pillars are visible. For class 2, the soft palate is visible but the pillars are masked. For class 3, only the hard palate is visible. Classes 3 and 4 are considered criteria for difficult intubation. In intensive care, a different score is used called the Makocha score. So it's a scoring system. So the criteria, there are criteria scored as 5. It's mainly Malampati classes 3 and 4, obstructive sleep apnea syndrome, 2 points. The others are scored 1 point, cervical mobility, limited mouth opening, coma, hypoxemia, and the presence of inexperienced operators. The threshold is 3 or more. So if the score is greater than 2, you should consider having an experienced anesthesiologist present before intubation. So along with other difficult intubation tools, the difficult intubation cart, additional techniques, so these complementary techniques are being used more and more. It's mainly ultrasound. Ultrasound is being used more and more, but it's not very widely used in emergency settings. Thank you.